Their research focuses on elaborating the psychological, behavioral, and physiological mechanisms of therapeutic action of psychedelics when used in a naturalistic, ceremonial, or clinical setting, particularly with respect to their potential utility in treatment of developmental trauma. They draw on the theoretical frameworks of contemporary psychoanalysis and interpersonal neurobiology in order to approach an integrative understanding of symptom reduction and character change associated with psychedelic experiences. And so with that, I'll invite CJ to share their presentation with us.
Hey, everyone. Yeah, thanks for the introduction, Leo. I don't know if the paper got sent out, if y'all have read this or not, but I'm basically just gonna give an overview of this paper, The Acute Effects of Classic Psychedelics on Memory in Humans. It's a systematic review of the various experimental and qualitative and observational studies of how classic psychedelics acutely affect memory. So the paper begins with kind of a historical, setting the context for this study, why a study of memory. And since psychedelics emerged as objects of scientific inquiry in the West, namely, in around the late 40s and then the 50s, the question of memory has really been at the center of the discourse around the phenomenology and the subjective effects of psychedelics. The dominant psychiatric paradigm at that time was psychoanalytic, specifically, mostly an ego-psychological paradigm. And psychiatrists were noticing as they were giving psychedelics to patients, especially LSD, but also mescaline, they were noticing very frequently that patients, patients in psychiatric hospitals or patients in psychotherapy would spontaneously report accessing unconscious memories, especially unconscious traumatic memories. And this was very commonly attributed as one of the central therapeutic mechanisms of action of psychedelics, that psychedelics were facilitating access to unconscious traumatic memories, and then subsequently facilitating what's called an abreaction, cathartic abreaction, which means kind of a purge of a certain quantity of repressed affect, and that it was this catharsis that was one of the central curative factors in the psychedelic experience. And nowadays that's not talked about as much. The sort of theoretical paradigm of psychotherapy and psychiatry has changed from what it was back then. A lot of the contemporary psychedelic research focuses a lot more on the mystical experience as almost the sine qua non of what is healing in the psychedelic experience. And psychodynamic processes have kind of been downplayed, and personally, I think that kind of parallels the general turn away from psychodynamic theory in kind of the dominant psychiatric establishment. But I'll kind of circle back to that in discussing some of the implications of the findings that I review in my paper. So the paper is divided into two sections. The first section deals with studies of memory task performance. So this is kind of the more cognitive side of memory. This would be, these are experimental tasks of memory performance. So an example, a kind of paradigmatic example would be what's called the digit span test. And in the digit span test, you give somebody a string of numbers and you ask them to recite the string back to you, and then you see how many numbers can somebody recite back to you. What's the length of the string that somebody can keep in their working memory. Another example might be, you give somebody a list of words, you ask them to study that list of words, and then maybe 20 minutes or an hour later you come back and you ask the person to recall as many words as they can from the list. That's what's called experimental episodic memory. And then there's also semantic memory. Semantic memory means kind of memory of knowledge, memory of facts. So, who was the first president of the United States, something like this. And, across every study that I reviewed, I found that classic psychedelics acutely impair these kinds of memory task performance in a dose-related manner. So the higher the dose, the higher the impairment seen on these tasks. But I want to spend more time on the second half of the paper, which goes into the effects on autobiographical memory. And that's just really because of my bias. I'm not a cognitive psychologist, I'm a clinical psychologist in training. And I'm really interested, as Leo said in my bio, I'm interested in the therapeutic mechanisms of action of psychedelics. So there aren't a lot of experimental studies that have been done on how psychedelics affect autobiographical memory. And also, when I say autobiographical memory, I mean memories related to the self. So these can be episodic in nature. These can be, I remember this place and time, this happened to me. But they can also be affective in nature. They can be sensory in nature. They don't necessarily have to have the kind of spatial and temporal coherence that we would typically associate with episodic memories. They can also be more like diffuse emotional memories about something that happened to us. So like I said, there have not been very many experimental studies, and what I mean by that is taking a group of participants, administering them a placebo on one day, and then a psychedelic drug on another day, and kind of comparing between the 2 days how was autobiographical memory different, across those 2 study days. I will just mention one experimental study that was done by the team at Imperial College, Robin Carhart Harris and his colleagues. So they had participants provide a list of 30 or more personal memories of specific life events that were positive and emotionally salient for them. And then the participants came up with certain visual cues that would be associated with each of these emotionally positive memories. And then they put the participants in an fMRI scanner and gave them psilocybin. And while they were in the scanner, they showed them some of these visual cues to cue some of these memories. And afterwards, the participants, compared to when the same procedures were done on placebo, on psilocybin, the participants rated these memories as more vivid, as more visual in quality, and more emotionally intense. So, in terms of contemporary research, that's really the only experimental study that has directly targeted how classic psychedelics might be changing the quality of autobiographical memories. But it's already beginning to provide some experimental evidence that psychedelics can make autobiographical memories, especially emotionally salient, emotionally meaningful autobiographical memories, much more vivid and much more emotionally rich, intense. But the rest of the studies that I reviewed were all qualitative or observational in nature. So a lot of these were studies with the 2 major categories were clinical trials of psychedelic-assisted psychotherapy. And so these would be studies of participants in those clinical trials, and then interviewing those participants about their experiences, about what they experienced during their psychedelic trips, and what what to them they considered healing. What elements of the experience were contributed to the therapeutic benefit that they derived from the experiences. And the other major category would be, along the same lines, interviewing people who have done ayahuasca in, naturalistic or ceremonial settings. And really across all of these qualitative and observational studies, people were time and again, this echoes the reports of psychiatrists and researchers from the 50s and 60s. Time and again, people were reporting accessing memories that were often traumatic in nature, often from childhood, and often that they either previously had awareness of but had forgotten for some time, or that they had never had awareness of, that were these were memories that they were encountering for the first time. But not just experiencing these memories, also reliving them. So the process of remembering these experiences had a different quality from how we would typically experience our memory. It's an immersive reliving, almost a sense of being back there, being back in that original experience, that original event. And then third, so the first quality is that, or the first phenomenon is that people are accessing these unconscious memories. Second is that they're immersively reliving them. And then third is that they're attributing a lot of the therapeutic benefit that they're deriving from the psychedelic experience to precisely this accessing and reliving of unconscious traumatic memories. So like I said, most of those those studies are qualitative in nature, they're observational in nature, and I think that more experimental work is going to have to be done to really establish, to some degree, establish the validity of those reports, because a lot of these studies, they were taking place in clinical trials, in psychotherapy settings, they were taking place in ceremonial settings where people were taking ayahuasca, and people could have certain expectations of recovering unconscious memories that affected their experiences. So I do think, on the one hand, I do think that experimental work is going to be important to establish this as like a really robust phenomenon. But that said, it's robust in the sense that it has been so frequently noted as a salient feature of the phenomenology of the psychedelic experience. And in the few minutes I have left, I'll just like propose a psychological model of what might be going on. And this is by no means original. This model can be found in a lot of that earlier analytic literature from the 50s. And people are still using this model to describe the psychedelic experience nowadays, even if it's a little less in vogue. But to put it in the kind of the clearest nutshell that I can, memories are kept out of consciousness, or the mechanism by which memories become unconscious is a defensive mechanism. It's a mechanism that the ego carries out defensively when there's some kind of psychic content, whether it's a memory or another kind of psychic material that is in some way unacceptable to consciousness. That it's maybe overwhelming, it's maybe too affectively intense, too painful, too challenging to our sense of integrity, the integrity of the self, to our self-concept, to our identity. However, in whatever way it's unacceptable, it's somehow unacceptable to the waking ego. And so the ego defensively keeps that psychic content out of consciousness. And that's what's called the unconscious. That material is kept in what we call the unconscious. And I'm sure that a lot of the audience here today is familiar with the phenomenon of ego dissolution, which is frequently noted among the effects of classic psychedelics. That classic psychedelics can loosen or entirely dissolve the subjective sense of having or being an ego, and the boundaries that constitute the ego, or that delineate the ego. Those boundaries are loosened, if not completely dissolved. And so, it's the ego. It's the ego setting up those boundaries and defensively blocking certain psychic material from entering consciousness. It's that ego that is dissolved, and so all of a sudden, that material that has been kept out of consciousness defensively by the ego begins to percolate into consciousness. And so, this is one proposed mechanism by which unconscious traumatic memories that have been kept in the unconscious, potentially for someone's whole life, can all of a sudden, without any deliberate effort on the part of the person, it's not that the person is intentionally trying to dredge up the traumas they experienced as a child. It's that the material is naturally beginning to kind of bubble up from the unconscious, because the barriers that were keeping it out of consciousness in the first place have been loosened or surrendered. And so, I guess I'll just finish with maybe a few thoughts on the clinical implications of these findings, and also of if this model holds true, then of this model, which would be that I and plenty of other writers have written about the therapeutic potential of psychedelics for disorders like PTSD, complex PTSD resulting from chronic or prolonged experiences of trauma in childhood, and the kind of working through of these traumatic memories, and of especially of the affects associated with those memories, in a really embodied way, feeling those affects that were never given the chance to be metabolized or digested in the first place, I think has the potential to be a really key therapeutic mechanism of action of psychedelic therapy. But I'll just finish with some potential risks or concerns, which is touches on something that I brought up earlier, which is that we know experimentally that psychedelics increase suggestibility, and there's also reason, or possibly some reason, to believe that psychedelics can also increase fantasy processes. And false memories occur in regular psychotherapy, and people who at the trait level or at the personality level are already highly suggestible or already highly prone to fantasy are more likely to develop false memories in the course of regular psychotherapy. So throwing psychedelics into the mix can kind of exacerbate that problem. And so for the therapist who's conducting psychedelic therapy, if a patient were to report an experience of recovering an unconscious memory, the question of how to deal with the sort of like the empirical accuracy of that memory, or like the actuality of that memory, how much of that memory really happened as the person is reporting it, how much of it is already imbricated with fantasy and with other forms of meaning. That question, I think, is it's very tenuous, and And I think that we can learn a lot from the literature on recovered memories, from the trauma literature and the psychotherapy literature. And I think that that's going to emerge as a really critical question in terms of the conduct of psychedelic therapy. And I'll just finish by saying there was a paper written recently by Chris Timmerman and some colleagues that really addresses this question head on. So I recommend that paper.
Perfect. Thank you so much, CJ. That was a really, really interesting talk. And I especially really enjoyed how you went into the model at the end. It was really interesting to hear. So thank you for that. As usual for our audience, you can drop your questions into the chat. If anyone would like to speak their question, you can use the raise your hand function and we'll unmute you. So to start off, we have a question here from Nick. And they ask, what do you think would be the best practice to help a person prepare for a psychedelic experience in regards to memory specifically, for both those who intend to address trauma and those who do not?
In terms of the second part, especially, I mean, in terms of the first part, I think that preparation, really for the most part for anybody, should focus on more than anything, the attitude going into the experience and having an attitude of surrender and openness and acceptance. But, you know, especially the second part, especially if somebody, or, you know, kind of this question around trauma and around traumatic memories, I think that psychedelics could have two uses. You know, if somebody has maybe a more classic presentation of PTSD in terms of, you know, they had a traumatic experience, they remember the traumatic experience, but they avoid remembering the experience because it's too overwhelming. You know, for that presentation, I actually think that MDMA would probably be more indicated for treatment, just because of the studies that have been done with PTSD, and also in terms of the neurobiology and the phenomenology of MDMA and the way that it can allow people to work through traumatic memories, you know, that they already have access to, but that they haven't been able to metabolize in psychotherapy because of the overwhelming or the dysregulating nature of the memory. In terms of, so, you know, then in terms of, okay, let's say somebody is interested in, you know, somebody thinks there might be traumatic memories that they're not aware of, and you know, maybe they want to use psychedelics to try to recover some you know, unconscious traumatic memories. I don't know if that's what Nick is asking about, but that I would recommend against, and I think that is pretty clearly grounded in the recovered memory literature, which is that, you know, as soon as a provider or a patient begins to have the intention of recovering a traumatic memory, then you've already opened the door onto suggestibility. You've already opened the door onto the development of false memories. And so I think that, you know, more than having the intention of trying to recover a memory, I think it's better to have the attitude of openness to whatever may emerge in the psychedelic experience, be it a memory, be it, you know, whatever else may come, engaging with it with a sense of openness and curiosity.
Thank you so much. Next question from Brian. Was there any research or mention of the role of the hippocampus on the effect of religious and mystical experiences with regards to memory during psychedelic experiences?
That's an interesting question, and I don't know the answer.
Fair enough. It's hard to know all the literature. I actually had one really quickly just from reading your paper. Right at the end, you like mentioned as a future direction that could be to like experimentally manipulate autobiographical memory retrieval in the context of psychedelic assisted psychotherapy. I was just wondering, like, how would you do that? I'm just so curious.
Yeah, you know, as I've presented this paper like kind of a couple times in different settings since publishing it, and I've kind of come to feel unsure about specifically that suggestion, because it's kind of suggesting exactly what I've just recommended against doing, which is like, you know, you could hypothetically set up a clinical experiment where, you know, half the participants are getting kind of like non-directive supportive psychotherapy, and then half are getting like, I don't know, a therapist who's really trying to like dig into to find the childhood traumas. But I don't, you know, even if it's a research setting, I'm not sure that that's ethical, because like I said, as soon as either the therapist or the patient has the intention of finding something that they're not conscious of, I think you're liable to start to develop false memories. But that said, I think that, you know, I don't know what this would look like, but I do think that there could be more rigorous ways of tracking memory processes that are going on in clinical trials, because so much of the research in terms of mechanisms of action has really narrowed in on the mystical experience, and there hasn't been a lot of attention paid to you know, for example, what kinds of psychodynamic processes might be going on that are having curative effects. And so if we could kind of refine our methodologies and figure out ways to you know, in some way measure or quantify like what kinds of memory experiences are people having during their trips, and how do those memory experiences, you know, whether fantastical or not, you know, whether accurate or not, how those memory experiences are relating to downstream therapeutic effects.
Awesome. Thank you so much. That was really interesting. So just in a you know, interest of time, we are going to move on, but thank you again, CJ. That was a really, really interesting presentation. We were really lucky to have you here.